The hopes that you bring, the dreams that you share, the pleasure you get when you know that we care, the faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, as USP, you before we, as USP.
USV, your reliable healthcare partner.
Hello viewers, welcome to this episode of Beat Diabetes. As we all know, diabetes has rapidly increased in India and has assumed alarming proportions. Today we'll talk about diabetes in women with special focus on diabetes in pregnancy. As we all know, there are major hormonal changes that happen during pregnancy, and some of these changes actually translate into an increase in blood sugar, leading to what is called gestational diabetes, diabetes that starts during pregnancy. Almost 15% of Indian women actually may be suffering from gestational diabetes. In addition, we are also aware that onset of diabetes is now happening at an earlier age. So to discuss both these aspects, pre-existing diabetes and planning of pregnancy and its management, as well as what to do with those who developed diabetes during pregnancy, we have a distinguished panel for you. To my left is Dr. Archana Sarda from Aurangabad, consultant diabetologist. We have Dr. Parjeet Kaur, who's a senior consultant at Medanta, the Medicity in Gurgaon, and we have Dr. Pramila Kalra, professor of endocrinology at MS Ramaiah Medical College, Bangalore. So let's start with Dr. Archana first. We talked about Indians being prone to develop diabetes in pregnancy. So what are the factors that drive one towards diabetes? In other words, is every woman at risk, or are there some specific groups that are more at risk?
There are many women who are more prone to become either diabetic or have gestational diabetes. These would be women with family history of diabetes. These would be women who are obese, who have had polycystic ovarian syndrome, women who have delivered a large size baby, and also women with a previous history of gestational diabetes. So these are some women who should watch out for diabetes and gestational diabetes, but saying that every woman is at risk and should definitely look out for it.
The factors you mentioned, these people should be especially careful in their pre-pregnancy sort of planning.
Sure.
So, Dr. Kaur, when you talk of pre-pregnancy planning, as I said, some people, as we know, develop diabetes at an earlier age. How should they manage their pregnancy, and what should they do before they actually become pregnant?
Those initial few weeks of pregnancy are very critical, because that is the time period when organ formation of baby happens. So there is very high chance that baby can have an organ defect if mother is having high blood sugar levels. Therefore, a good pre-pregnancy care or planning is must and should be started at least 6 months to 1 year prior to pregnancy. A very strict blood sugar control is must before pregnancy with target HbA1c levels of less than 6.5%. She should also consult her doctor for changes in the diabetes, blood pressure and cholesterol medications, and she will need insulin for the management of diabetes before her pregnancy. She should also be screened for the presence of any diabetes related complications in her, especially the eye disease or a kidney disease, because there is very high chance that these complications can worsen during pregnancy. So the good news or a message will go that with the proper pre-pregnancy care and planning, a woman with diabetes can have a normal pregnancy similar to that of a non-diabetic woman.
But if you plan in advance and you've got your numbers right with the right kind of medication, there's really not much problem and it's easily manageable. So if you're talking about gestational diabetes and pre-existing diabetes, so Dr. Kalra, how do you actually diagnose diabetes in pregnancy, and what should we do even for its management?
Yeah, that's very important, because a woman who comes for a checkup, for a first antenatal checkup, at that point of time we should do a screening for diabetes. That the normal recommended thing is we should do a oral glucose tolerance test, which is done by making the woman fast for 8 hours, and then a glucose is given. 75 grams, and then we check the blood glucose levels at 0, 1 and 2 hours. And it's also good to do one test called as HbA1c, which gives us the average of past 3 months blood glucose levels, because with these two tests at least we can know women who already have diabetes and they have become pregnant. In case a woman is normal at that point of time, she does not have diabetes, or she has come to us first time at 24 weeks around, and that is the time, that is 24 to 28 weeks, when an oral glucose tolerance test should be done for all the women, because that is the time when the incidence of gestational diabetes is maximum. So we should definitely screen the women at that point of time if they have missed screening at the first visit, or in case they were normal at that time and now they have come at 24 to 28 weeks of pregnancy.
But ideally, probably at first visit,
Yes.
Every woman merits at least a blood glucose value.
Yes.
And ideally, actually even an HbA1c,
Yes.
because that will tell you about unknown pre-existing diabetes. It's a 3-month average, right? So I think it's important here, number one, that screening is mandatory. It should be universal. For every woman who's pregnant should be screened for diabetes. For diagnosis during pregnancy, doing just a fasting or just one value may not be sufficient, and most women may require what is called a glucose tolerance test. So why should we really worry about complications about diabetes in pregnancy? And I think the reason for that is that if diabetes is uncontrolled, as Dr. Parjeet pointed out, you would get problems in fetal organs. In the first few weeks of pregnancy, when fetal organ formation is happening, control of diabetes is especially critical. That is those who already have diabetes. And the reason is that even this mild increase in blood glucose that happens typically around 24, 25 weeks of pregnancy can actually impact the baby, not so much the mother as the baby. And what can it do to the baby? The baby may be large, may be big, and therefore delivery may become difficult. Okay? And after delivery, the baby may get breathing problems, like respiratory distress syndrome, we call it, may get low blood sugar because the insulin levels may be higher at that time. They may also get jaundice, transient jaundice. So a host of things can happen if women who have high blood glucose during pregnancy are not treated properly. Having said that, with the proper use of medication, especially with use of insulin. And proper advice about diet and exercise, most women can be managed very successfully. So there are very few oral drugs that are used for this. Primarily it is insulin based and primarily diet and exercise based treatment. So while uncontrolled diabetes during pregnancy can give rise to all these complications, actually you should be seeing nothing. If you're managing your diabetes well under proper care and guidance, you will not get any complication. And now we'll take a short break, and as you know, we have something interesting lined up for you after the break, which you will learn as soon as we get back. So stay tuned, and we look forward to having you with us after this short break.
The homes that you bring, the dreams that you share, pleasure you get when you know that we care. The faith that you place, the trust that we share, the joy in your heart when you know that we care. You before we, at USV. You before we, at USV.
USV, your reliable healthcare partner.
Welcome back after the break. And as promised, we have a quiz contest for the audience. We do this to gauge the level of awareness and understanding that the audience has about the management of diabetes. At the start of the show, we had conducted a lucky draw from the audience members, and we selected 4 of them for this quiz contest. So let's get to know who our contestants are today.
I'm Rakhi Juneja, and I'm diabetic since from 19 years. Within 6 months during my pregnancy, I was diagnosed with the diabetes. So from that time, I started with my insulin. You have to change your lifestyle and the pattern of your lifestyle, how you're managing, and the eating habits, and you should have on time the food and all, everything should be systematic in your lifestyle to maintain your diabetes.
Myself is Narendra Kaur Gill. I'm living in Gurgaon. I'm 58 years old. Just 2 months back, I came to know I'm a diabetic patient, and it was really beyond high. We can fight with the diabetes. It's not a disease. It's just change of lifestyle. I'm sure, 100% sure, you can come out from your diabetes or any other disease. I'm very happy. I'm doing really good.
I'm Savannah from Muradnagar. मेरी उम्र 41 ईयर्स है। मैंने पिछले 10 सालों से इसको बहुत ही लाइटली लिया, लेकिन मुझे अचानक 10 साल बाद पता चला कि मैं इंसुलिन पर आ गई हूँ, तो मुझे शौक लगा। 3 स्टेप होने में ज़रूरी हैं कि अच्छे डॉक्टर्स, डाइट और हमारे वर्कआउट। इस चीज़ से हम डायबिटीज़ पर कंट्रोल पा सकते हैं। मैं इससे वाकई में बहुत फाइट करके मैं उस पर आ चुकी हूँ। अब मुझे खुद जीने की इच्छा होती है, वरना मैं वाकई बहुत ज़्यादा परेशान थी।
मैं विजया सिंह हूँ, मेरा एज 54 इयर्स है एंड मैं एक होम मेकर हूँ। साथ में मैंने अपना केयर इंडिया फाउंडेशन, मेरा एक NGO है, उसमें मैंने डायबिटीज़ के अवेयरनेस के लिए लेडीज़ प्रोग्राम करती हूँ। ड्यूरिंग प्रेगनेंसी 28 इयर्स पहले मुझे पता चला कि मुझे डायबिटीज़ है। उसके बाद डॉक्टर्स के कहे अनुसार मैंने फॉलो किया, डाइट कंट्रोल, मेडिकेशन, क्लोज मॉनिटरिंग ऑफ ब्लड शुगर। इससे मुझे बहुत हेल्प मिला।
Before we start, we need to understand the rules of the game. There will be 5 questions. Each question will have 4 answer options. The contestants will be given voting pads having options A, B, C and D. And the contestants will select one right option, either A or B or C or D. Every right answer will get 10 points. The wrong answer will get no points, but there's no negative marking. The total score for all contestants will be displayed at the end of the contest. The one who gets the highest score will be declared the winner, who will be given a prize. But we really want all of you to be winners. We really want everyone should score the maximum. That's the idea of this quiz. Let's start the quiz. And the first question is, gestational diabetes predicts that A, the woman has high risk for type 1 diabetes, the woman has high risk for type 2 diabetes, baby will get diabetes at the time of birth, and D, the woman is not at any risk for diabetes in future, as typically gestational diabetes disappears after delivery. Punch in your answer now. And the most amazing start to this quiz is that everyone's got the answer right, which is B. So B means that a woman who has gestational diabetes is at high risk for developing type 2 diabetes in the future. Absolutely right. So Dr. Archana, would you like to explain that further?
Yes. Gestational diabetes essentially means that woman is in a state of pre-diabetes. So even after delivery, when the baby is normal and the mother is normoglycemic, that the blood sugar levels are normal, it still means that she can get type 2 diabetes later in her life. So it's very important not to just be happy and not consult your doctor ever again, but to actually go to the doctor and ask for tips regarding diet, exercise, weight loss and screening, so that diabetes would not develop later at some stage. Having said that, we are talking so much about young women with diabetes. Young women are going to have diabetes, they are going to get pregnant, but with good care, the outcomes are fabulous.
So I think that's a very, very important point. Thank you. And therefore, if you put on weight progressively after every pregnancy, you're increasing your risk of diabetes that much. So I think that's very, very important. Let's move to question number 2. Oral glucose tolerance test for the diagnosis of gestational diabetes is conducted during 12 to 14 weeks of pregnancy, B, 24 to 28 weeks of pregnancy, C, 32 to 36 weeks of pregnancy, and D, before you get pregnant. And the time to punch in the answer is now. And again, we have a great performance. The right answer is 24 to 28 weeks of pregnancy, and 3 out of 4 participants have got that right. And I think that's very encouraging. Wonderful. So can I ask Dr. Parjeet to explain this a little bit more, this 24 to 28 weeks?
So 24 to 28 weeks of pregnancy is the time when hormonal changes in mother are at maximum, and that can lead to the high blood sugars in mother. So even if the initial blood sugars when she came in the initial 3 months of pregnancy are normal, a woman can still develop high blood sugar at this point of time. Therefore, we are kind of giving a glucose challenge to detect the hidden high blood sugars in mother. And as Dr. Pramila already told, it's a very simple test. A woman has to come fasting, a certain amount of glucose is given, and then blood glucose is checked 1 hour and at 2 hours to detect any presence of high blood sugars in her.
So I think again a very important message from you that everyone, every pregnant woman should have a blood glucose done either at first visit, but certainly between 24 to 28 weeks, regardless of whether you have diabetes or not, you have family history or not. Let's move to question number 3. The mainstay of treating diabetes in pregnancy is A, diet, exercise and oral medication, B, diet, exercise and insulin, C, only oral medication, D, only insulin. And please punch in your answer now. So we have an interesting mix of answers here. The correct answer is B, diet, exercise and insulin. But only 2 of our 4 contestants have got that. One has said it's only insulin, one has said it's only oral medication. So I think this needs a bit of explanation, and I request Dr. Pramila to do that.
It is very important that when a woman is pregnant and she has got diabetes, the first thing she has to be told about is to modify her diet. That is called as medical nutrition therapy. And it is also important to note that she should not starve herself. Many a times when we tell a woman that you have diabetes and you need to control your diet, they just stop eating. That is not correct. They need to have a correct proportion of carbohydrate, protein, fiber and fat in their diet. The second thing is exercise. Some women who are on bed rest may not be able to do exercise, but the other women who are normal, they should do exercise as prescribed by their obstetrician regularly during their pregnancy. The third most important thing is that if these 2 things are not working alone, then she might need medical management with insulin. And that is the safest thing to be given in pregnancy for blood glucose control. And last thing, that women are very skeptical that they will have to continue insulin after their delivery. That will not happen because this is only a short-term thing. But after delivery, as Dr. Mittal said, that they may run a high risk of getting type 2 in future, so they have to be cautious about their lifestyle.
I think very, very important points, Pramila, and I think the fact that insulin is the mainstay of treatment, although drugs like metformin are being increasingly used with safety during pregnancy, it is diet appropriate for pregnancy, exercise appropriate for that patient and pregnancy, and insulin if required. Let's move to question number 4 now. If gestational diabetes is left untreated in the mother, how does it affect the baby? A, the baby will have high birth weight. B, there can be low blood sugar in the newborn baby. C, the baby can have breathing difficulty. And D, all of the above. Please punch in your answer now. Correct answer is D, all of the above, which means you can get high birth weight, you can get low blood sugar in the newborn, you can get breathing difficulty in the newborn. And as we explained, all this can happen even in cases of not pre-existing diabetes, but people who've developed diabetes at 24, 26, 28 weeks of pregnancy. All these complications are significant and can have a major bearing on the outcome, as you can see. However, these are all preventable complications, because if patients are following their doctor's advice, checking blood glucose regularly, taking nutrition therapy, exercise and or insulin as indicated, they really have very good outcomes. So while these things can happen, they should not happen, and they really can all be prevented. Let's move to question 5 now. Women with type 2 diabetes are at increased risk of heart disease. Options: A, regardless of age; B, after 50 years of age; C, after menopause, and D, only if they have family history. Can you punch in the answer now? And the right answer is A. 2 of our contestants are saying after 50 years of age, and 2 are saying only if they have family history. And while these answers are not wrong, they are incomplete. Yes, if women are over 50, there's greater risk of heart disease. If they have family history, there's greater risk of heart disease. But the point here is that women with diabetes are at risk of heart disease regardless of their age or menopausal status. So the risk for heart disease in women with diabetes is, it takes away the protection that they usually have till menopause. So I think this is an important point. Heart disease in women is often missed. Conventionally it's been thought men are the ones who are at risk for heart disease. But when you have diabetes, that protection that women have is taken away and they're also at risk. Important point to get your cardiac evaluation done as advised by a doctor from time to time. And the winner for today's quiz is Mrs. Narinder Gill. Big hand. But as I said, this is a quiz where everyone is a winner. We've all learned from each other, and congratulations to you. Dear viewers who are watching and supporting this program from your home, you too are an integral part of our show. You can test your awareness level of diabetes by answering this simple question. And the question is, children born to mothers with gestational diabetes are more likely to get type 1 diabetes, B, type 2 diabetes, C, low immunity, D, anemia. Out of the 4 options shown to you, please SMS the choice of right answer to the phone number displayed on the screen. Polling lines will be open till Monday 12 p.m. The winner will be declared in the next episode by a lucky draw from the right answer.
The winner of Beat Diabetes Episode 1 viewers' question is Rajshri from Pune.
And with this, we come to the end of the episode of Beat Diabetes.